At Maximum Upright Health, where we help you think right, move right, and feel right. Today I'm going to show you an exercise that I have a lot of personal attachment to. The side of my hip was bothering me for a very long time, and I did many exercises, many different stretches, and it just remained stubborn and didn't get better. So I started doing some exploring, playing around with it, putting a softball on it, using a foam roller, and voila, my hip started feeling 10 times better, and I couldn't wait to share the good news. So I started helping some clients with it. They started feeling better, and what was amazing to me is that some of these injuries and some of these clients were feeling pain in this hip for years. And I'm not trying to convince you that this is going to solve all your hip problems, but if you do have pain in the side of your hip, I really encourage you to try this. The easiest way to get in there and to get those muscles to relax is to use a softball, and you're going to place the softball against the wall, and you're going to place the softball right against your outside your side hip, looking for the glute medius and the TFL. It's also a good way to start learning where those muscles are for future exercises. So what you're going to want to do, you don't want to move too much. You want to move slowly around the muscle. And once you find a spot of tension, stay there. Stay there for 30 seconds to a minute. Definitely explore. If you're really tense there, you may have to hang out there for a while, and you may not get much done in the first day, right? So really take your time. If it's really bad on this first progression, this is something you should be doing every day. If that starts to get easier, you can move on to a lacrosse ball, see how that feels, if that feels any different, if that's a little bit easier for you or harder. The first progression on the floor is using a foam roller. There's two options here. The first is just to lay on your side and put pressure right into those same muscles. The second option is to kind of sit on the foam roller, put one leg over the other, crossing it, and then putting your hand out for support and getting deeper and deeper into those muscles. If that starts getting easy and you feel like you can get more aggressive with relaxing those muscles, you could put the softball on the floor and put it right into those muscles again, do some exploring, and as you get better and better, you'll be able to drop your upper body lower and lower to the ground. Once the softball starts getting easy, you may want to start using a lacrosse ball, because the lacrosse ball has a smaller surface area and it can really get deeper into those muscles. Another option, especially if you're having issues getting into hip flexion, is actually to get into hip flexion while you're doing the soft tissue work on the side of the hip. So same principles apply as you've been implementing in the other variations. You're gonna explore the region, looking for areas of tension. Once you find something, hang out there for 30 seconds to a minute, and just stay consistent with it. If that type of position seems to give you difficulty, then you know that that's something you're going to want to continue working on. Okay, so for programming, personally, when I realized how beneficial this was to me, I was doing it every day. Every day for 10 to 15 minutes for a few weeks. That spot that's been bothering me for months, maybe even years, started feeling much better. And that's what I tell my clients. If it's really tense and you're having trouble just putting a foam roller in that spot, get at it every day. Work on it consistently every day. If you're busy, it's not too much, I recommend at least 3 to 4 times a week where you have some time to relax, do some soft tissue release, and enjoy what you get out of the exercise.
Yep, I found some pretty good spots on my hip doing this exercise, but what about you? Let us know how it felt in the comment section down below.
Hopefully you get some benefits from this exercise. Please check out the description box below for some helpful links. Please subscribe, and as always, pain sucks, life shouldn't. That's like, that's what people think lawyers do. And then it's like reality is like, yeah, right.